You're between two dumbbells. I'm your host, Skip Hill, and I'm bringing over 40 years of bodybuilding experience to the table, including over 24 years of online coaching. I'm joined today by Dr. Marv, also known as the Educated Meathead. I don't know if anyone has noticed, but his head's a little larger than most, and that's because it houses a ginormous brain. For each show, we posit a thought about a training exercise or training methodology. Then we do a deep dive into the minutia. We argue and debate, but we might also pull hair and break a nail. Who knows? The show could devolve into an episode of Jerry Springer. However, when the dust settles, we both decide if we would smash or pass. Of course, we'll also be doing another segment of Intimate Time with Skip and Dr. Marv. And then we'll finish, as always, with a few listener questions, which are typically, though not always, related to a past show. Remember, every time you comment on the show on YouTube, you'll be included in a drawing at the end of each month to receive a Team Skip t-shirt of your choosing from the teamskip.com store. And you'll receive Dr. Marv's online bodybuilding anatomy course. Of course, your comment on YouTube needs to be more than just for the algo or the one-arm flex to be considered for the monthly drawing. We'll post the winner for the month on my Intense Muscle IG account. And we'll also reach out to the winner via their YouTube account. Dr. Marv, I'm going to hand it off to you. This is your posit, I believe.
Yep. All right. So this is a big one. So we'll see how far in the weeds we get. My posit is just because you're injured doesn't mean you have to stop training altogether.
I don't know. I've said numerous times for the 41 years that I've been training, if I took time off every time I was injured, I'd probably have 6 total years of training. And it gets worse the older I get.
Absolutely. So that's a big thing. People come into the office and they're freaked out. You know, I have this left shoulder injury, or I broke my left arm. Well, I can't do any upper body work. I haven't gone to the gym. I'm like, well, first of all, how would a shoulder injury impact leg training?
Yeah.
And then there's things you could do with a fancy thing called the crossover effect that we'll talk about. But yeah, I make a living literally of helping people train around injuries. So this is going to be a big one, and hopefully people gain a lot of information. So on the screen, we're going to put up my personal injury history. As you can see, it's quite a bit. Everything from a major head injury at 17 to where 70% of all my childhood memory prior to that is still gone. Insomnia, migraines. I've torn both shoulders. I retore my left one for a second time in November. I've got now, like we talked about in the past, arthritis, degenerative joint disease, degenerative disc disease. That is gray hair of bone. Nobody's getting through life without it. If you live life on your terms, you've had trauma, it might happen sooner, but it is. But yes, I do have, I know at least 4 joints have severe arthritis in them already. My left elbow has bone chips in there. I have multiple tendon issues. My left wrist, 3 surgeries. I've seen 32 doctors for that alone. 5 of them said I was making it up for attention. That's why I'm a chiropractor, because I have something called complex regional pain syndrome. Broke that arm. I've had 9 total surgeries, broke my back, disc herniations. We suspect I have 2 torn hip labrums, but I'm too much of a wimp to get an MRI / it's not going to change anything. Yeah. 4 surgeries in my knee. No meniscus in that knee. I tore my calf last year. I've destroyed my ankle, blah, blah, blah. So I'm pretty damn beat up. It's very rare for somebody to be more beat up than me. It is what it is. And guess what? For 17 years, I've been able to train, and I'm not an IFBB pro, but that's what I look like. And that's pretty respectable given how injured I am. And I'm not great genetically. So if I could do this, anybody could do this.
Yeah. I don't want to list my injuries because I thought they were pretty bad, but because you went first, my list isn't going to be very impressive. Yep. You sound like there are soldiers who come back from 5 tours.
Yep.
Who have been exposed to chemical agents, carcinogens, you name it, jumping out of planes. They have no cartilage in their knees. And they're in better shape, I think,
Yeah.
and have
Yeah.
less injuries than you do. That's crazy.
So it's a catch-22 because something on my body is hurt since I was in the 6th grade every single day of my life. So it would be nice to have a day where something didn't hurt, but I probably wouldn't be sitting here on a podcast with you
Sure.
because I personally got fed up with the medical system, especially when it came to my wrist. I also had a really crummy surgeon when I was a kid who did 7 surgeries before I was 18. 6 were unnecessary or done wrong, blah, blah, blah.
Oh.
Sorry, we're getting too much of my story, but I got fed up. I took matters in my own hands, and that's why I do what I do today.
Well, and I think people need to know too, you're an outlier, clearly. I mean,
Yep.
people may have a lot of injuries and everything, but you are definitely an outlier. And the fact that you are still training, that says a lot, and took you down the path that it did, as far as chiropractic. So I do want to point this out, and I think you'll agree with this. The vast majority of people who are dealing with injuries, they're training related in some fashion.
Mm-hmm.
Not all of them, but the vast majority of them are. I know I've said that, thankfully, from day one, I was very, very strong with mechanics. It for whatever reason, was at the top of my list. And I focused on it quite a bit because had I not done that, I think my list of injuries would be far more extensive. Because if you factor in, 41 years of training is
That's
a
a
long
lot.
time.
Yes.
And
That's
I've
longer
only
than I've been alive officially.
That's a very good. Wow. Yeah. I am the T-Rex of the podcast. I know a thing or two about training, but I built a reputation in the bodybuilding industry for removing skin. If you have too much skin, call me. Remember, skin is overrated. Yeah, it is. It's a long time. So, and those last few, I say last 2 injuries since I've been 50 have been the worst. But the funny part is, or irony is, it wasn't really related to age, and it wasn't related to training. Now, the training may have exacerbated it, at least the second one. But the point is the vast majority of them weren't from training, when usually that's the case. So I've been very, very fortunate over the 4 decades that I have trained that I don't have, I've never torn a pec, had a minor tear to a bicep. Mine has been lower back issues, which I now 9 years injury free, which is not a lot of people can say. And that's after 9 L4, L5 herniations. So that 9 is my special number, apparently. So, and then of course the torn glute, which got into the articular cartilage of the knee. But those were related. When you tear something in your glute on your left side and you have to then favor the right side, not in the gym, but just in life, getting in and out of a car, sitting down on the toilet or the couch, you just favor that side. And I never had any knee problems. So then to go into that, there was quite an extensive rehab there, which I'm happy to touch on later when we get into this and how I did it. But take the reins and run with it. How do you want to proceed down this injury training path that we're on?
Yep. So we need to say the disclaimer is obviously there's a difference between injured and being hurt. And if it is a major issue, you need to be screened by a medical professional, right? Because they're different types of injuries respond different ways. So if it is a muscle tear, a muscle strain, that will get worse with activity and feel better with rest. A tendon is the exact opposite. A tendon will get better with activity. There's a warm-up effect, but once you cool down, it'll hurt like hell. So you want to load an injured tendon, so within reason, right? It's not like hanging on by a few threads, but you don't want to load an injured muscle at least right away. So there is usually a time frame that I'm looking for. So say, let's just give the worst case scenario. Somebody does pop a pec the first 3 days. I'm just trying to get blood flow only. To his credit, the individual who came out with the RICE protocol, the rest, ice, compress, elevate, he is on record saying the icing part was the biggest mistake of his career, and he's retracted that. So we no longer preach icing. You could maybe ice for the first 12 to 14 hours for pain management, but beyond that, icing is actually going to impair healing, which is starting to become more accepted. But in case you didn't know that, you don't want to ice. So we follow something called peace and love in our office. So say, heaven forbid, you just popped a pec, or like Logan, who popped his pec and he had to do a powerlifting meet 3 weeks later. So we do peace and love. So right after, P stands for protect. So obviously don't do chest movements, right? Elevate. Obviously you can't elevate an arm with a pec, but you sit upright. Avoid anti-inflammatories. So that includes ice, that includes ibuprofen. Now, like over the counter, like curcumin, pro-resolving mediators, boswellia is okay. Like those are fine, but you don't want education only, possibly.
Okay.
Yep. So I will say, when I tore my calf, I was treating it within 30 minutes. I actually made my chiro associate at that time come into the office on a Sunday to treat me within 30 minutes. So that's nice when you're the boss. I personally started BPC that day, but I can't give direct medical advice about that. So there's that. But the natural stuff, curcumin, fish oil, pro-resolving mediators, I think we talked about them. That is a godsend after an acute injury. So now that's mandatory for me. You can compress stuff. So compression helps with swelling and pain. And then the E stands for educate, which means like, don't over-treat it in the beginning. So this is where people get it wrong. You think you would want to treat a ton right away. The first 0 to 3 days, I don't do a ton other than blood flow, whether that is laser, E-stim. I have that fancy E-stim machine that I do. Very usually no like tooling or scraping, because if there's a bruise from a tear and you start tooling and scraping or grasping, whatever word you want to call it, over that, you could actually cause a calcium deposit in the muscle tissue itself. So no, right? I use a fancy type of tape, biomechanical tape. It's called dynamic tape, that offloads tissues. So we'll use that. And then from days, full 3 days, so 72 hours to 7 days, up to 10 days, I still don't do a lot of aggressive treatment. Once we get to the 7 to 10 day mark, then I'm going to be super aggressive. Because if you start treating when the body's doing the initial healing processes, you could like create further damage or not let the initial healing structure set, for lack of a better word. You could almost think of it as, like letting concrete set, like you got to give it some time. And then once you get to 7 to 10 days, obviously every injury is different, but I'm going to try and load it, get more blood flow, all that. So the love and peace and love is post-acute. That is loading it gradually, being very optimistic. Yes, how you talk about your injury makes a world of difference. I could tell you, I have 2 people come in with the identical injury. The person who is, this is what happened, it sucks, but give me the answers, get me treatment, is going to heal quicker and better than the person who is devastated and depressed and sitting on the pity pot. And I know that is harsh, but for myself, at least, I give myself 12 to 24 hours to feel sorry for myself. And then the next day it's figure out the bleeping solution and treatment. Vascularization, so blood flow. Gentle cardio is one of the best things you could do for any injury anywhere in your body. So if it's you tore your pec, you're getting on an exercise bike. And then the E stands for exercise, right? So peace, protect, elevate, avoid anti-inflammatories, compress, and educate when it's an acute injury. Post-acute setting is love, load, optimistic, vascularization, and exercise.
Love it. Got a question for you.
Yep.
Can I get in real quick? You want me to wait?
No, keep going. Yeah.
Okay. I like the note about not icing, but I want to know why. Is it? And I'll tell you the reason that I ask this is you still were talking about taking things to help with inflammation, to reduce
Mhm.
the inflammation. Icing can do that. So I'm assuming that it's reducing the inflammation is not the issue. Isn't it then limiting blood flow?
Yep, it's limiting
Okay.
blood flow, and so inflammation's not the enemy. If we shut down because what's buzzword? I'm inflamed. What the fuck does that mean? I hear that at least once a week in office, and I'm not trying to like call patients out, but that's a buzzword. I'm like, what does that even mean? Because no. But anyways, because it gets the tissue temperature so low, it stops blood flow. Your body can't get all the waste products out and the stuff in there. We do though. Now this is going to seem counterintuitive, but we do have a machine called Game Ready, which is cryo and compression, but it's 34 degrees, so it's still not as cold as ice. But there's what's the word? It's like a pulsatile compression that comes in waves to further help blood flow and not let everything sit.
Okay.
So it's really helpful post surgery or post acute injury. I made a post the other day. Unfortunately, one of my patients hurt his knee really badly. And I was like, while I hope we never have to use this machine, because if I have to use the Game Ready, it means something went wrong. We do have it, right? So that's great. But compression and blood flow are the two biggest things you could do. The icing will straight up delay the healing process. And I know people will want to like ice their elbows or their quad tendons post workout because of the little bit of inflammation. That's a different type of fluid buildup in the tendon. So the ice won't even help that. So that old school of, put the frozen bag of peas on your elbows post chest day or on your knees post leg day, that's not even really accomplishing anything. But there's that.
What if my wife punches, hypothetically,
Mm-hmm.
what if my wife punches me in the eye and I have a black eye? Is a bag of peas still a good idea?
You're
Because
going
that's
old
just
school cold steak, right? Isn't that what they used to use?
right, exactly. I'm dating
Yeah.
myself with that. Yeah.
Mm-hmm.
Going back to happy days when Mrs.
Yep.
Cunningham put the steak on Fonzie's
Mm-hmm.
eye. Yeah.
Yep.
Uh, that's bad. Okay. So if I'm understanding this correctly, the original guy who came up with rice,
Mm-hmm.
then figured out that, okay, ice is wrong. We'll get that out of there.
Mm-hmm.
Uh, resting is wrong, so we'll get that out of there. We'll change it to mice. Oops, can't change it to mice because motion is
Mm-hmm.
better than rest, but that still has the I in there and we don't want ice. So basically you had to just throw the whole damn thing into the trash and start over with peace and love. Now, was that his?
So I don't think he came out with peace and love. He
Okay.
came out with, I think it's meat. There's a bunch of them.
Yeah.
Just peace and love made the most sense to me because it's acute and post acute. And that I really like that because there is differences to it, right?
Well, and it's way easy to remember.
Yes, correct. So but there's several, but yeah, but I'm giving that, I forget his name off the top of my head. But I'm giving him credit. How many experts will be like, oh, by the way, I got this wrong? Because he became known for that. Like,
Yeah.
I have so much respect for that.
Mm-hmm.
Like, holy hell, that dude should be getting an award for integrity and not caring about perception of being right, but getting it correct.
Well, clearly he wasn't part of the bodybuilding industry because we don't do that in our industry.
Correct.
That is seriously lacking, quite frankly.
Yep. So you have that. Again, and I have to be kind of the 10,000-foot view because every injury is different.
Yeah.
But things what I do early on, a lot of laser, newbie E-stem or using an electric glove. I had a young bodybuilder tear his pec. He came in within 6 hours because he came in and we treated him, taped him, did the glove. We started him on fish oil and pro-resolving mediators. It wasn't a terrible tear. But he did have so here's something really cool. If it's a minor tear, we'll stick to the pec because that's what we've been talking about. Mm-hmm. Say the tissue damage is there. Okay. So that's where the tear was, but a nerve in the skin got pulled here. If I release that nerve in the skin with tooling or cupping, the pain will go away. It's really common in hamstring injuries. The tissue injury in sprinting was up high on the hamstring. What we do is it's called a jump sign. You take a toothpick or whatever, and you draw a tic-tac-toe over the entire injured area. If they literally jump and that toothpick or whatever device you're using feels like a hot knife, that tells you there's a nerve in the skin that is entrapped causing pain. So you cup or tool where that nerve in the skin is. All of a sudden they get up, they're like, I have no pain touching my toes. Now this is a grade 1, 1.5, maybe grade 2. It's not a full tear. So grade 1 is a few fibers. Grade 2 is more fibers. Grade 3 is it's off the bone. And it sounds weird, but grade 3 actually is way less painful than grade 2. Yep. But if it's like a grade 1, maybe a grade 2, I might be able to start loading that hamstring that day with isometrics and stuff like that. So that's typically what we do. If
let me go back to this real quick, just so I want to make sure I understand. If it is okay, you make the tic-tac-toe, you feel pain in the area, and you say there could be some type of nerve entrapment there. If you cup the area, then you'll know it's a grade 1 if the pain then is reduced significantly after the cupping, correct? If it's not, isn't that cupping going to be incredibly painful? You're going to know.
So it really depends on the person. So so it's very person dependent. So
but it still would be significantly more painful if it were a grade 2, and you'd almost know right away.
Well, I would know because grade 2, I say, hey, load your pec, adducting towards midline. They're gonna like barely have any. They're gonna have a hard time moving it. Also, you'll be able to feel it. Right? Like when my powerlifters, unfortunately, it's happened a couple times. I get a message on a Saturday, dude, my pec just went at the meet. I'm like, if I'm available, I go to the office right now. That way we could start treating them right then and there. But if it's like a really bad one, they're not going to be able to lift their arm. They're in excruciating pain, blah, blah, blah.
Yeah. Okay. Now I don't want to go down the wrong path here. So pull me back in if I am. My brain is saying this. Correct me if I'm wrong. The main injuries then that we're dealing with in the gym are muscle, tendon, herniation. And I had a fourth. Cartilage, osteoarthritis.
Yeah,
am I stretching here a little bit?
Yeah, that's kind of stretching. So usually training would help arthritic joint, because you could have an arthritic joint and it could be a disaster on imaging. But if there's no inflammatory response, it's not really painful. When an arthritic joint is painful, and it's just osteoarthritis, right? It's because there's inflammation there. So usually similar to a tendon, an arthritic joint or a tendon. So it's a tendinopathy, tendinitis. They are different, but that's beyond the scope of our talk. Those will feel better with activity and then start to hurt again when they cool down.
Okay. Because I figured there's similarities there, because that's what I was dealing with the last injury, and it was on a level that I had never dealt with before. So where it may not seem maybe as common, I kind of put it up there with, like, it can happen and it sucks. Like, it's a long, and arguably so is tendinopathy, or which is, correct me if I'm wrong, but it's chronic tendinitis. Correct?
So this is a bit of a nuanced discussion. A lot of people call it tendinitis. It's more accurately tendinopathy. Tendinitis is there's inflammation in the tendon. Tendinopathy, we used to think it had inflammation. It's chronic. There is no inflammation, but there's actual degeneration and degenerative changes of the tendon. And here's where people go wrong. I can't tell how many people, they have, front of the shoulder pain. They go to their primary. Their primary is not a musculoskeletal specialist. They give them a cortisone shot, or they give them some prednisone, and they tell them to ice and rest it. That is literally the worst possible thing to do to a tendon issue. You need to load. That's why isometrics, which we're about to get into, like for tennis elbow, your tennis elbow's hurting, you do an isometric for 30 to 60 seconds, 3 to 5 of them, that will pump water out of the tendon that already has some degenerative changes. There shouldn't be water. There shouldn't be nerves in a healthy tendon. When we have chronic degeneration that has not been handled correctly, you'll start to get nerve fibers in there. And then that's when that really sucks, because you're going to have issues with that your whole life. But the isometrics will pump water out of the degenerative tendon as well as decrease pain.
This is why I wanted to touch on this real quick. I don't want to spend too much time on it, but a lot of clients and a lot of people, especially the older demographic, tend to not give tendinitis or tendinopathy the attention that it deserves. It's almost viewed like, oh, I'll just deal with it. Yep. Maybe eventually it'll go away. Oh, it's not getting worse, so it's okay. And I get tired of telling them, you're creating a vulnerability here. Whether it gets worse or not, the fact that it's not going away is something that could end up being a huge injury that is going to force you out for 3 times longer than it will to just back off, keep moving, keep blood in there, but back off on those either specific movements that are irritating it or training that entire muscle heavy and intensely, and just get blood in there with those light reps, lightweight, pump it, get the hell out and leave it alone. And a lot of times it's backed up by the fact that, well, once I get training and once I'm done training, it feels great. Of course it does. You've warmed it up. Yep. It's not stiff. It's not cold. But what does it feel like a day or two later? It feels like garbage again. It arguably is going to feel worse. And if it doesn't feel worse, it's certainly not going to feel better.
Yeah. And just to, again, this is when you might need to have a medical professional look at you. Shameless plug. I do telemedicine in Texas, and I do consults worldwide. But a patellar tendinitis or tendinopathy, that is one of the tendon issues that actually doing your activity may make it worse. But an Achilles tendinopathy, you could keep doing your sport. It's just going to be painful. So different tendons react differently to the activity you're doing. So that you need to keep that in mind as well. So you have these issues. Isometrics are such a powerful tool, and nobody does them. That we used to do them a ton. So yes, there's isometrics for strength, but there's isometrics for rehab, injury prevention, blah, blah, blah. I do need to say 2 things. One, though, there is a difference between discomfort and pain. When it is a tendon issue, guess what? Discomfort is the cost of doing business to rehab it. Okay. So for in office, I tell patients, you get to choose the line in the sand. Is it a 3 or is it a 4 out of 10? That is discomfort. 4 or 5 out of 10 is pain. Typically, that means you did too much, typically the day before. So yes, if you're rehabbing a bicipital tendinopathy, tendinitis, which is one of the most common injuries in people who've been lifting for periods of time that we've talked about several times, you're going to have to deal with some discomfort. I am of the mindset of modify, don't completely eliminate. When somebody does have a bicipital tendinopathy, tendinitis, I tell people, and not everybody listens, I'm like, hey, let's temporarily avoid overhead pressing. Let's temporarily avoid Olympic lifting. Let's temporarily avoid bench pressing. Usually you could do all the back training you want in the world. Shoulders are hit or miss. Sometimes lateral raises are doable. Sometimes they're excruciating. But let's keep you training in the gym, but modify, don't eliminate altogether.
Which is funny because every injury I've had that I've worked around, I figured out that it allowed me more recovery to the other muscles that I was training. When I had the quad problem, my hams started getting really good because the knee didn't get in the way of the hamstring work. So when you give up one, it's almost like you have this glass and it holds 100 ounces. And that's your recovery. Your max recovery is 100 ounces. Well, if you take out 20 ounces because you're no longer training chest, then you're going to have 20 ounces to put into back, shoulders, arms, or legs to stay at that 100 ounce recovery ability without going over. So it's kind of a funny thing where I don't think anybody listening to the show would say, I have such a world-class physique that I can't stand to not train. Psychologically, I get it. We all deal with that. I couldn't stand that I couldn't train it either. But you make the best of the situation that you have, and you might accidentally, without meaning to, bring up a lagging muscle group. So if you do have that injury, focus on adding that work that is missed or the intensity that is missed in the injured muscle and put that on the muscle, on a different muscle group that could stand to use more work and benefit from it at that time. One of the things I've always said about the injury, there is a silver lining to an injury. I know it's hard to find it.
I say that to every single patient.
If you don't, I'll go so far as to say this, if you don't come out of an injury learning something about your body and your training, you have wasted the best opportunity to learn either how to train around or train through that muscle, or you have learned that you needed more work somewhere else and you end up benefiting. There's a silver lining in there. You have to find it. And while you're moping and you're in your pity party for the 12 to 24 hours at the beginning, transition to that. Okay, how can I benefit from this injury while I'm rehabbing this? It's huge. It's huge. So let me ask you this.
And then real quickly before you change topics, and I still want to go back to ISOs.
That's where I was going to go.
I do not want you in a caloric deficit rehabbing an injury.
Thank
you
you.
need a
Very
size
good
surplus. Yeah. So like when I was doing a secret prep, tore my shoulder, I was 4 weeks out. I pulled it. I just had the conversation, obviously, on the other podcast right before this, talking about this, where, not to be rude, but if you injure yourself and you're 4 weeks out from an amateur show, don't do the damn show. Get into rehabbing and recovering, right? Mm-hmm. Unless you're a pro, unless you have some sort of sponsorship commitment, only go on stage when you're ready and when you don't have this injury. Okay. And you being in a steep caloric deficit, if you're doing things that are further dehydrating or drying you out, that's the worst thing. So slight caloric surplus, hydration is absolutely paramount. Everybody talks about muscle being 70% water. Nobody talks about tendons and ligaments being 60% water. And once soft tissue dehydrates, it's not like muscle tissue. It takes a hell of a lot longer to rehydrate, right? So slight caloric surplus, hydration is so damn important. If you could increase your sleep somehow, increase your sleep. Over the counter, yes, there's things you could do. We could talk about that. We could not. I don't care. It's up to you. But slight caloric surplus, hydration, and then isometrics.
I just want to add or piggyback off of that, and that is this applies to deloading too. Even if you're not doing a show, you want to maximize recovery, whether you're in rehab and injured, or whether you're deloading with your training. That's the crux of deloading. So people will ask me, well, I'm not training you. And I understand. I'm not bashing them for asking me. I want to make that clear. But logically, you don't want to decrease calories because you're doing less work. You want to either keep them the same or even increase them to feed the recovery. And it's a very good point close to a show. And it takes me to a story that I heard. I believe it was Andrew Barry, who found out that he had a very huge vulnerability with his bicep when he was very close to a show, and just from posing, flexing the bicep, had a minor bicep tear.
Yeah.
I mean, that right there will tell you at what level of recovery are you when it's coming into a show. Your body is just beat to crap at that point. So, recovery is horrible.
Quit 4 or 5 plate stiff leg or Romanian deadlifts 4 weeks out, please. Like, yes,
there's literally
no one who brought you to
that.
the dance. Yeah, bring the one who brought you to the dance. I get that, but the final 4 weeks, especially if you're doing NPC or IFBB, we know what that means. Do not, like, your training has to change, right? It just does, period. So like, respect that, because tissue's already dehydrated. Other things could further actually change the actual structural weave of tendons that will weaken it independent of you being -5% body fat to where it hurts to walk. Like, so training needs to change. So isometrics, they are spectacular. So how an isometric will help, if it's a muscle strain, we start loading it with isometrics as soon as possible. Obviously, again, it's not a grade 3. You've been examined. We know it's loadable. So isometrics are great. Start loading isometrics as soon as you possibly can once you've been cleared. Then here's what the isometrics are really cool. So I'm on a bench because shoulders. And as I come down, I realize right here, I have pain in the front of the shoulder. I'm going to back off 5 degrees and do my isometric there. Why am I backing off 5 degrees? Isometrics will train strength and structural integrity 10 degrees either side of the joint angle. So if I'm here, I back off 5 degrees and I'm doing my isometric, I'm starting to train into that painful range of motion and getting my body used to going back to that range of motion without actually causing pain. Okay. So isometrics are incredible. We also know there's some performance benefits from doing isometric, like super max isometric holds before you lift. Like, since you're a baseball guy, right? It got out that the Astros were doing isometric trap bar deadlifts in the dugout and then going up to bat, and they were dinging it left and right. Like, isometrics are awesome for performance and for rehab.
Well, the anti-Houston fans, they're complaining about the trash can. So they're not going to give any credit to it. It's just such an old beat down topic, but I digress.
Yeah, but it's just making a point. Like, isometrics are freaking awesome, and they're not used, especially in bodybuilding. Some strength sports use them more, but they're great. So isometrics are great. We know I'm a huge fan of blood flow restriction, both to do the actual exercise from Dr. Jeremy Lenicky, the 30, 15, 15, 15 reps. If you don't know what I'm talking about, it was episode 2 or 3. We did a deep dive in blood flow restriction. I will also have people do the cell swelling protocol. So perfect example, one of my awesome power lifters, his knees, all sorts of messed up. We started him. It took 2 weeks because there was still a ton of swelling and inflammation, and you don't want to be doing things that could make that worse. But we're now doing the cell swelling protocol where he puts his cuffs on his leg, 5 minutes on, 5 minutes off. In research, you do that 3 times post ACL reconstruction, and folks are healing anywhere from 5, I believe it was up to 30% quicker from just BFR cell swelling. And that's, the leg is totally immobilized. You do not move or load a knee that has an ACL reconstruction. So it could work better for that. Or I'll even have folks with rehabbing a knee issue, especially like a patellar tendonitis. They put the cuffs on their legs and they ride a stationary bike for 5 to 10 minutes. That's another way to use blood flow restriction to get a ton of blood in there, help the healing process, tell your body to send its own local growth factor. So blood flow restriction, I think more people think about BFR for rehab and recovery than performance that we've talked about, but BFR is such an amazing tool.
And let me touch on the 5%, because if someone might be thinking, oh, 30 is great, but 5, let's just take an arbitrary number and say it takes 100 days to recover. That's 5% is 5 days. I mean, that's closing in on a week. So over the course of what, 3.5 months, arguably a little over 3 months, 3.5 months, you pick up an extra week minimum when you could pick up an extra month.
Yep.
So we're talking 1 to 4 weeks that you can benefit. That's math off the top of my head. So if anybody's going to bust me on percentages, I don't appreciate it. Point is it's in there between a week and roughly 4 weeks that you could save simply from the BFR. And there's no movement. Like you said, it's the joint is mobilized. Like, wow, that's pretty impressive.
Yeah, it's amazing. What else can we do? So let's stick with the leg with ACL. There is an actual medical terminology called arthrogenic inhibition, which as a defense mechanism, your body will crank up your flexor muscles and crank down your extensor muscles. So the quad, that we'll have a hard time getting the quad to fire again, right? the body guards. It doesn't want to fire the quad. So getting the quad strength after an ACL is big. So, or similar to like hip flexors and glutes, instead of stretching your hip flexors for the umpteenth million time, how about you fire up your glutes? Firing up your glute will get your hip flexor to relax. So sometimes, when we have an injury, our ancestors didn't have doctors. So your body's doing its job and it's trying to create a splint or a sling, and it's spasming muscles. It's shutting down force output. That's why you come back from an injury, especially if it's upper body, and you go back to finally training, everything's shaking every single rep, right? That's just the neurological defense mechanism. It will go away with time for the most part. But yeah, the body's going to try to protect you. It's going to shut down force output. Other muscles are going to get super tight and spastic, right? That's why when people have an acute shoulder injury, they might only be able to lift their arm 5-10 degrees. That's it. You get the spasm to subside. Yes, they still have pain or discomfort, but they could go from here up to here. I'm a huge fan of dry needling. You need somebody to do that. I love my newbie E-stem machine. A good example, and then we'll talk about just range of motion and what I do for my knee, and then see if you have any other questions. When I tore my shoulder, I was doing dry needling, and I literally could only lift it. Oh, I had torn my right one, and I could literally only lift it to here, and it was painful as hell. And they're like, we're going to needle here, which I said, no, the hell you're not. But they needled my subscap, needled my rhomboid, needled my levator and my trap. And all of a sudden, I could do that. And my business partner and I took it together, and we locked eyes, and we went, that just was worth the whole weekend. Like our $1,000 or whatever it was, that was worth it all. So you get this. So people come in and they're in excruciating pain. I'm not going to crank on their shoulder, but if I could get it to calm down, whether it's dry needling, shockwave, newbie, usually I do shockwave in that scenario. If I could get it to calm down and I could get some of that special tape on them, they'll start gaining range of motion. So I'll be like, hey, let's have you come back in a couple of days. If you're still a complete disaster, we'll get an MRI. But a lot of times you could get that initial defense mechanism to calm down. It's amazing what you could do.
I use dry needling weekly. I just had to cancel my appointment right before we started today. But nonetheless, I get it for a preventative or a proactive approach. And it's combined dry needling with cupping with motion. And that's just through my rotator cuffs, so that my scapula, I have one scapula that doesn't want to open up as much as the other one. And it fixes it. As long as I do it consistently once a week or once every 2 weeks, it's a non-issue. And I typically try to do it the day that I train back. So I get it done, and within an hour and a half, I'm at the gym training back. It takes like 2 sets to warm up. And everything,
and it can make a world of difference for posing too. Like when people are locked up. So I'm doing a beta test with a coach where he's sending me pictures of clients, and then I'm giving them movements to do.
Nice.
And then do their posing. So once I have that streamlined, we'll announce it. But yeah, he sent me a guy, and I'm like, he probably needs to get needling done. Like you can only do so much with manual work on your own and exercise, and it'll literally look like a different human being.
Oh yeah.
From
even without the imbalance. I'm opening up another easy half inch on each side.
Yep. And then I really so newbie is direct current E-stem, and there's an electric glove you could use. And I'll do tissue work with people. In fact, we could actually pull that up so people know, because if you could find somebody who has the newbie.
I'll ask about that. He's a doctor of physical therapy, and he is, with an agency with other doctors. So as an example, he's pretty high clientele or highbrow clientele when he shows up to Bob Greasy's house and does Bob Greasy's work.
Yeah.
And then Bob Greasy, I get a picture of Bob Greasy scooping out the Team Skip protein on his counter in his home in Miami because he uses Team Skip protein.
That's awesome.
Yeah, it's on Instagram, because I'm sure someone right now just heard that and they're like, whatever, Skip's so full of crap.
That's funny.
It's actually true.
Here is Tristan Themister. He got third at nationals. And this is doing the newbie right before his bodybuilding show. Here's the newbie glove. So I have an electrical current going through the glove. So you could obviously use pads to bring back strength post-injury, combat that arthrogenic inhibition, decrease pain, ton of blood flow, right? And then when he poses again, all I did was just the newbie glove. That was it. You could see the before and after. And that was step 1 out of 3, right? So the newbie glove, if you could find somebody who has that, not only can you use it for treatment for mimicking your cupping or dry needling, you could put pads on and make people stronger, pump out a bunch of blood flow. Like acute injuries, it's one of my favorite machines. And so, yeah, if you could find access to that, it's amazing.
What would go sideways with dry needling?
Like you could hit a blood vessel and then all of a sudden there's a gnarly bruise and the skin can barely raise. The odds of that are very small, but I don't do anything. Like I'm very conservative. I'm aggressive, but I'm not. Meaning, yes, I want to load somebody as soon as possible, but I am very selective of when I do things just like that. Yeah. Like so I don't like dry needling somebody if they're going to go train within an hour.
Okay.
Like I want 3 hours just because, but you're used to it. But like you've never been needled before, it'll feel like the needles are still in the muscle. So it could throw people off. So first time ever, like when the CrossFit Opens around, I'm like, you're doing the CrossFit Open? Are you, when's your heat? If I've never needled them before and they're going to go train 30 minutes later, hell no, I am not needling a bicep because I don't, heaven forbid something happen, I would feel responsible.
Now you're talking about dry needling with electrical stimulation, right?
You could, or even without. Yeah, I love E-stim, but even without, like obviously up here, you worry about lungs, so you should not be leaving needles in. I know people do, but
yeah, I've not done dry needling without E-stim. It's always been with E-stim.
Yeah, it makes it work better. You could do it for performance, so you could needle glutes, have the current to a specific setting that helps with motor unit recruitment. That's what all my powerlifters come in the week before their meets, and we know I work with some absolute freak shows, and they swear they're stronger. I had to order special needles to get through their damn glutes. So
yeah, my guy says that I have a thick skin.
Yep.
I thought he meant that I was fat, but I think what he means is I'm older and like my skin is like leather.
And certain things increase collagen synthesis everywhere, including skin. And then I actually learned this from you last thing, and then you'll see where you want to take it. And then, yes, we know warm-ups matter. I've preached that till I'm blue in the face. And then when you said this on BSG, I was like, why the hell have I not thought of this? I'll always try and do blood flow restriction on my knees before my main movement, right? To help warm it up. But I'll ride a stationary bike for 1 mile and it takes me around 4 minutes. And then I do that because friction, remember, lubricates the joint, creates blood flow. Like, I'm like, why the hell? For as smart as I am, I'm dumb. And so I stole that from you, and now that's mandatory on leg day. Yes, I'm doing blood flow restriction, but I'm warming the area up. Last thing for injury, we kind of touched on it, the crossover effect. When you have an injury on one side, guess what? You could still train the other side heavy and hard, and the research is pretty clear. It will help maintain strength and size in the injured side, even if it's immobilized, and may speed up healing. So it's called the crossover effect.
This is where we're going to finally disagree. I have waited for this day.
Awesome.
And it's finally here. It only took us 8 episodes. I'll tell you why. I'm not denying what the studies say. I'll start with that. Neurologically, I get it. The problem I have is this. I have seen that create long-term muscle imbalances from one side to the other versus letting the uninjured side rest while the other side is resting. Okay, so I have a different, I don't want to say even a different protocol, but a protocol for coming back from an injury where you literally just have to rest it. And that is this. I'm going to explain this as concisely as I can. You have, left and right side. If your strength is this high on the one side and it's down here from the injury on the other side, I want to train to the weak side. And what I mean by that is this. let's just say that they're legs for the sake of discussion. Okay. And we'll say it's a quad. We're doing body weight. I can't do body weight. We'll do isolateral hammer strength presses. Okay. And, kind of seated, horizontal, which is a great movement. It worked great for me because a lot of times we don't see the imbalances in legs because we're doing either fixed machines like a leg press or a hack, where you can drive with a little bit more with the stronger side and really not even know. Even arguably when squatting, you can still get away with it. I know I was doing it. I literally had to go to isolateral movements to be able to tell, oh man, I'm still behind on this one side. So that's where it came to. Well, I don't want to say it came to. It kind of reinforced my idea of left rep, right rep, where you like to do all the reps on one side, say 15, and then do the 15 on the other side. I don't like that because so much can happen between 1 and 15 that by the time I get to 15, I'm not at the same level of fatigue and failure on one side as I am on the other. So for someone OCD, that is not symmetry to me. Okay. When I go left, right, if I feel that one is a little bit stronger than the other, I could slow down the movement and subtly, not, banging out reps on the strong side, but try to control and make sure that that form is even on each side. And there's really no way to favor one side when you're doing something isolateral. A walking lunge would be another good example. The reason I don't want to use a walking lunge or didn't want to is because I wanted, when I first started, coming fresh off the injury, I wanted that resistance to be very, very light and build into more resistance. And the seated isolateral allowed me to go lighter than the body weight, my body weight for a lunge. Mm-hmm. So what I do is this: when I say train to the weak side, what that means is, well, I'm going to use failure as kind of the benchmark here. This is with the assumption that the injury is not still there. It's healed, but there's an imbalance with strength from left to right. So what I'm going to do is I'm going to continue to try to talk while one of my cats decides that he wants to talk at the same time and let everybody know that he is starving. Anyway, start with the weak side. So we're going to say this one's weaker because the strength is down here. So we're 1 rep, we're 1 rep. We're 2 reps, we're 2 reps. We get to 9, arbitrary number again to make my point. Closing in on the failure mark. This one's easy. We're done. Okay. And the reason I say I don't want to necessarily train to failure, because I don't want to tell people, oh, you're coming off an injury, train to failure, isolateral. Mm-hmm. Well, you may not be familiar with isolateral training. And even though it's a machine, you still have more stabilizing going on with isolateral work, and a lot if you're doing something like a walking lunge or something like that. Mm-hmm. If you happen to do walking lunges and you have a hard time balancing, even after fatigue, you got to question your stabilizers and the coordination there, and arguably the strength of those stabilizers as well. Even in your ankle, when it comes to the muscles on the side, the medial part and the lateral part of your calf. But anyway, or the lower leg. So training that and taking that intensity, what you're essentially doing by training to the weak side is you're training that weak side more intensely. If you just took the one, you're going back and forth, oh, I can't get any more on the weak side, so I'm going to do more on the strong side. Then what you have is you're going to increase the strength on the weak side at the same time that you're increasing the strength on the strong side. So your imbalance is staying the same, or it's staying unequal. If you train to the weak side and you stop when you're close to failure on that weak side, then that is going to slowly catch up. You're not going to grow here, but you're going to bring that weak side up until it meets. When it meets, then you've got that equal strength on both sides, and then you can go balls out, and you could arguably go back to fixed machines or squatting. And the reason I think that you don't want to do something like squatting, where you have to balance, you're doing both legs at one time and you have to balance, is because you have an imbalance of strength. And if you have an imbalance of strength, your hips are in a bad position, which means your lower back is in a bad position. Everything's in a bad position at that point. So at least if you're doing isolateral, you're doing one side at a time, you're training to the weak side. And I have found my experience with myself, with my injuries, and not just the knee and the torn glute, but years ago when I had the lower back injuries, same thing. So that has worked so incredibly well for me to bring up the imbalance to where they're actually even versus having clients. And I never recommended it because I've never liked it. What'd you call it? Crossover training, I think you said it was called.
Crossover effect. Yep.
And what that does is when people do that, they come back with arguably more strength even on the strong side, and that gap is even bigger than had they not trained the strong side. You would have like a gap, say like of this versus, oh, I've been training the strong side. So it's going to take a long time to catch up, and arguably it could just continue, that gap or that disparity could remain longer. And that's what I've always seen. I get from a neurological standpoint that what the studies are saying, I totally get it. It just hasn't played out in practice that way. I just have not seen it happen that way.
I took notes.
And like I said, shoot me down. I want to hear I want to hear you
let me
counter it.
clarify, because we still have something we disagree on finally, which is great. Finally, I can tell you to fuck off.
Yeah, exactly.
No,
God, you're stupid.
Yeah, so crossover effect. I am saying when somebody has an acute injury and they can't train the side, so say you have really bad bicipital tendinopathy, or heaven forbid you had surgery or you tore something, I want you still training the opposite side as heavy as you can to maintain strength and size, especially if you have to be immobilized, right? So the crossover effect is that. So it's more, for some reason, you cannot load the opposite limb. I don't want you taking time off altogether. I want you getting blood flow, whether it's cardio, but I still want you training the good side as heavy as you can. Obviously, you're going to be doing machine work, basically, right? I don't want somebody trying to balance a single heavy dumbbell when they have a tear in this side, like jerking it around is the worst possible thing. But I still want you training the opposite limb as heavy while you are recovering from injury, surgery, or rehab. But where I still disagree is how we do unilateral. So I am adamant, and I got this from Dr. Scott Stevenson, about continuous reps. So no pausing, because I am OCD like you, but I am OCD with every single set execution is the same from week to week. So I am somebody who has a damn metronome going in my headphones during every work set. So every negative is 3 seconds. Every pause in the stretch position is 2 seconds. Like there's no guessing. I also do continuous reps. So there is no 1 or 2 breaths, like do 8 reps and take a breath or 2 to regather and go.
Right.
I want to keep what Dr. Scott talks about is like sprinting full speed toward the cliff and trusting that I'm not going to pause to regather. It's not a widowmaker like we talked about last week, so like all the few people, I don't do a lot of one-on work. Everybody I do one-on-one with has been with me for years, but in all my workout programs that I still do, I want continuous reps unless I clearly say you could take a breath or 2. I want those continuous reps, because what if one week you take 2 breaths, the next week you take 4 breaths? Your logbook's going to say something different, and I'm not going to remember how breaths I took. When I do unilateral, I want that whole leg or arm or leg continuously. The only time you wouldn't is if walking lunges, but I strongly prefer split squats to lunges because it's the same leg. And what you do is you start with your weaker side. So for me, it's my left leg because of all my surgeries. And then I merely match on my right leg. And unilateral training strength so one leg, one limb will translate to bilateral 2-leg strength, but bilateral strength does not translate to unilateral strength. So that's a really important caveat.
Yep.
So when you all my power lifters, they're stuck at a certain threshold squats and they're like, when's the last time you lunged? I haven't lunged in 7 years. We start getting them to lunge, they break through that plateau. Plus we talked about how I like finishing a movement, especially with legs. And I got this from Dr. Danila Martina, of doing the walking lunges to kind of restore that balance. So there's big with that. So yeah, I don't like doing one arm, the other arm. I know you like doing that. To me, that's too many variables that I can't keep the same. And that's personal preference. Maybe that's been studied. I don't know. That's still evidence-based because it's my bro science versus yours.
Sure.
But I still want you training heavy while injured, the opposite side. And then that's how you bring it up. And then, yes, with lunges, a big thing. I'm glad you brought up the ankle because nobody thinks about the ankle, and something that's really important, especially if you've rolled an ankle, trauma to the foot and ankle, or the fact that I make a terrible joke. We wear foot prisons our whole lives. So it's like wearing gloves on your hands your entire life. And then for me, 39 years later, realizing I can't play the piano. Well, duh. But there's 11 small muscles that reside within your feet. They get dimmer switched or dampened down from trauma or foot prisons. And those are tied to a ton of performance benefits, mainly something called proprioception, which is knowing where your limb is in space without looking, which is why when those get diminished, there's a delay or they don't fire at all, your ankle sprain risk goes up. That's why you want to have a second ankle sprain, you have a first one. So it's directly tied to proprioception, which will delay. So you're having that delay for your brain figuring out what's going on at your foot. That's how a little thing that you should correct turns into a full ankle roll. Mm-hmm. 2, they dampen vibration. So especially if you have plantar fasciitis, knee pain, or you do a bunch of stair mill for cardio or walking, or you're running. If you see me running, take off. There's a bear coming. So they dampen vibration with that. They're tied to bunion formation. And while you don't think it necessarily bodybuilding, they're tied to lateral agility on the field. And now we're starting to see it's tied to sprint speed. So if you have shit balance with lunges, I would look at the foot, the ankle, making sure it's strong. And then there's something called, everybody could look this up, called Vele's test, Velee. You could do it yourself at home, see if your foot's firing. And then there's a guy named Dr. Thomas Michaud. When I want to feel like an idiot, which isn't hard to do, I listen to that man talk and I'm like, how the hell do you, like, he'll quote research while drunk on a podcast. I'm like, how do you do that? So he's super smart. And he created a device called the Toe Pro, but you could mimic it at home. And that would be really important if you have terrible balance with lunging, right? Fix it. You have chronic lower body injuries. A lot of times you're not dampening vibration, blah, blah, blah. But Vele's test, and then look up Toe Pro, and that would be incredibly helpful. But I will not do unilateral the way you do. And that's great. We disagree. So I'm really excited about this. I will do one limb straight at a time. I mean, I don't even like doing alternating arm curls. Now, somebody's going to say I just posted that. Yes, I did like a pump finisher where you're doing like a mechanical drop set. And when you can no longer do the 2 arms together, when you switch to 1 arm, it gets easier. We've talked about this. That increases motor unit recruitment. So that's a way to extend the set, almost like a drop set. But now I'm getting a pause in. So that's how I'll do it. But yeah, I'm not going to do one leg, then the other leg on a isolateral glute press.
Now, 2 things I want to clarify with number 1, that I typically will only do one isolateral move that's alternating per body part. If I do, I don't want to say if I do it all, because I typically do, but it's with back, sometimes side delts, especially for side laterals. It will be for legs, for quads. So quads, back, side delts, sometimes alternating dumbbell curls. So I'll say this: the rest of my sets are straight, like you do them, where you just, you don't stop, you don't take a break, that sort of thing. Here's my argument that, and I get what you're saying, that there is a rest between the 2, but we're not talking about setting down the dumbbell. So as an example, in a back row, just using that as a, or it could be a hammer strength isolateral pull down. The back is still, the muscles in the back are still, they're remaining in the stretched position. So
Mhm.
even on the rare occasion, and it's very rare that I would do, because we talked about this a couple shows ago, an incline dumbbell press alternating for just a different variety. I wouldn't hold them at the top. I would hold them in the bottom in the stretch position, much like I do with back.
Mhm.
So there is going to be more tension doing that versus uh, if it were a different movement where the muscle that I was training was actually just kind of resting, or and bicep curls is a good example. In the bottom position, there's not a whole lot going on in the bottom position of a bicep curl. Now, with you could say, well, you just said side lateral skip, but we talked about on the last show the method that we like for side laterals, and that is keeping the traps slightly contracted so that in that bottom position, even though you're holding it and you're doing the other side, there's still going to be a good amount of tension. It's not like I'm just letting that arm hang down with far less tension. So I think that there's still an element of I'm focused on keeping as much tension on the muscle while the other rep is being performed. I mean, we're talking, I don't know, 2 or 3 seconds. I don't time my reps,
Okay.
but it's not like this long rest. That's number one. But number two, I wanted to come back and ask you about the studies of training the non-injured side, because you said that it helps to maintain strength on the injured side.
Mhm.
Did they give any numbers? Like, is this
I don't know that off the
significant?
top. I don't know that off the top of my head, unfortunately. I do think mentally it's also nice because people don't feel as broken and fragile if you could still train something. But a lot of people will do what you do and say, well, isn't that going to make me super imbalanced? And I go, in the long run, it's going to wash out. Also, we're never perfectly symmetrical. Even though we try to do our best, we never will be. You ever get a DEXA scan, one leg's going to be slightly bigger, one arm's going to be slightly bigger. To us, we see it and we go, how the hell does not everybody see this and trash us online? But the average, even a bodybuilding enthusiast isn't going to notice a ton. Like, it wasn't until somebody pointed out to me, Nick Walker's, how his quad sweep's different. I was like, oh, well, now I see it. I never saw that
Oh,
before.
yeah.
And
There'll
I'm a
always be that
huge Nick
shape.
Walker fan. Yeah.
Yeah.
But I'm just
Even
like, it is what it is.
yeah,
Right.
right.
So I am a big believer in the crossover effect because I've seen it help the mindset of somebody that I talked about that will help with recovery as well.
Okay, well, for the record, I'm still gonna pass the shit out of it when we get to it.
Yeah. And like, I get what you're saying. Yeah. And yes, it makes more sense to me to rest with a dumbbell press here because moment arms, right? This is a lot more stable than there. And you're
Yeah.
getting a little bit of a loaded stretch. So you could say, hey, you're getting a natural blood occlusion effect similar to BFR. That's just our personal preferences. And I am glad it took us 8 episodes. You're not going to change my mind, and I'm not going to change yours.
And the viewers have
that's
those two
awesome.
options. They have
Exactly.
then they can go, okay, I can see where this.
So we'll
or
see if we're with Team Skip or with
that's
Team
right. That's right.
Doctor.
In
I
the
know which one I
comment
would go
section,
with.
I'm gonna go with the meathead. I'm gonna go with the guy with the big brain. That's funny. All right,
Yep.
are we gonna? I think it's time to smash or pass. I
Yeah.
think we have two. I think
Mhm.
we have the.
Yeah. So should you train while you're injured, so long as it's safe to do so? Smash. Should you do the crossover effect while you're injured? I'm going to double smash now. And every time I have somebody do that or I have to do it, I'm going to tag Skip in every post I ever do from now on.
Fair enough. So you double
smash.
smash.
Yep.
Okay. I am going to definitely smash as far as training through an injury anytime that you can, unless you just absolutely have to rest. There's no doubt there. And I've had too much experience with that to look at it any differently. But I'm going to triple. I think you can see that one coming.
Yeah.
I'm gonna triple smash. I really am. I'm sticking with the fact that your psychological component argument is good.
Mm-hmm.
It won't work that way for me. I am OCD. I'm the guy who brushes my teeth with 2 hands. And someone's gonna listen to that and go, that doesn't have anything to do with anything. You're right, it doesn't. But that's the type, and you talked about the DEXA scan. I had a DEXA done, my first DEXA after my leg injury, 0.2 pounds difference from left leg to right leg. I was beside myself happy. And the 0.2, the extra 0.2 was in the injured leg.
Yeah.
So I was excited about that. And this is where you come back and you go, well, are you sure you weren't doing crossover?
Yep.
No, I wasn't.
And inflammation and all that. Yeah.
Right. Exactly. And it's so minor that, even with the DEXA, everybody gives the DEXA sometimes too much credit when it comes to those numbers.
It's not an exact science, but it's still nice.
It's arguably the best method that we have. That's the thing. It's got its flaws, but it's probably
the best method that is openly available to the public. And I might be partnering with the largest DEXA scan company in the United States soon. So
nice.
We'll see if I change my mind about that. Or if I all of a sudden become pro DEXA, because then I get money. Like, we'll see. To be determined.
Exactly. And they're not easy to find. It depends on the part of the country that you're in.
Yep. And then it needs to, so let's talk about it real quick. It needs to be in the same condition. So I don't want any food, drink, or water. I want it first thing in the morning. You want the same technician doing it.
Thank you. And the same machine.
You want to do something fun. Yep. Like same machine, same time of day, everything. You can do a DEXA scan, you chug water, all of a sudden you're going to gain 5 pounds of lean muscle mass. So try and keep it as uniform as humanly possible. And even if like we've talked about before, even if the machine's wrong the first time, so long as it's the same conditions, the same technician, you're looking at the relative change.
Yeah. Don't give the first DEXA too much credit. Count it or contrast the second, the third, and any scans after that. Absolutely.
The sweet music of love.
Marv doesn't know what I'm going to ask him, so he's got to think off the top of his head. And this is just one of those things that we're doing to kind of give you guys an idea of what we do or our thoughts or who we are outside of the industry. So the questions can't have anything to do with the gym. They can't have anything to do with the industry or Dr. Marv's work. I'd say my work, but that it's a given, I suppose. Ready?
Yep.
Best present you received for your birthday, because today's your birthday, if I'm not mistaken. So happy birthday.
Thank you.
And you got to keep it clean. Gotta keep it clean.
Yeah, I know. That's later. My woman was incredibly thoughtful and bought me a PlayStation because I've been talking about doing video games to because all I do is work. I work 100 hours a week. I love what I do. I know everybody in my support circle is worried about me, but I have a vision. I'm going to make sure it happens. But we're talking about me doing that. And I was actually going to drive over to GameStop this morning to buy one. And then last night she's like, hey, since you're taking tomorrow off, you're not allowed to work. Do your podcast. Cause I did this one. I did one with Paul Barnett and I want you to use this. And it was a PlayStation.
That's awesome. When you said that, I was like, I didn't know he was a gamer. So you're not.
No, so I'm really not. But it's nice to do something because, normally guitar is my outlet, but unfortunately I re-tore my wrist for the 5th time. So stem cells are coming this year.
Nice. Number 2, do you have kids? If so, do you like them? If not, do you hold on, let me finish. If not, do you not have kids because you probably won't like them?
Absolutely. I'm way too selfish. I work too hard. Now back home in San Diego, we had a guest room where our friends' kids would come and stay with us. I'm really good at being Uncle Marv for about 4 to 8 hours. And then after that, where's mom and dad? You got to go. So no kids, never wanted one, never will have one. Now I make a joke. I find this hilarious. She does not. I go, look, when I get to be Skip's age, I'm going to freak out that there's nobody taking on the moniker. So we're going to go to the orphanage and there's going to be tryouts, intellectual and physical tryouts. And we get to see who gets to come home and continue the name.
She'll never foster a kid because you said she has worked in the industry before. So that's a tough one. That's a tough one. All right. Number 3, your wife can only be very hot and mildly intelligent or mildly hot and extremely intelligent. Which one do you choose?
Oh, good God. Luckily she's both.
There you go. It's a safe answer. Good for you.
Yeah.
Good for you.
I think at this point, younger me would say hot. Now I want intellectual stimulation.
Sure. Number 4, last time you punched someone or got punched.
Years, thankfully. Probably not. I got in a fight with a fraternity brother, probably 2009. That was fun. So that's probably the last time.
You're a frat guy. All right. Did not know that. Number 5, without elaborating, have you spent a night in jail?
No. Shockingly.
Get with the program, bro.
I know. No fun.
Number 6, does your wife tell you which lane to use when you're driving on the highway? Basically, does your wife consider driving a team concept?
Yes.
I'm going to say, do you really marriage, bro? If
Yeah.
she doesn't,
Yeah.
I mean, come on now. You guys, I bitch at my wife all the time. Like, you don't have a steering wheel in front of you. Like, I don't see a steering wheel over there. Like, what the fuck? Like, I don't see every lane.
What
I
would
drive
be
an
hilarious
M5.
is if you cut out a cardboard one and tape it to the
Or she does.
Yeah.
Exactly.
Yeah.
Yeah, you can't
Or
say
a little
anything now,
Fisher
can
Price
you?
saying, yeah.
Damn. All right. Shit, you got me. Number 7, you get an email from an old friend and it is rife with poor spelling, punctuation, and syntax. Do you notice? Do you judge? Or do you
Absolutely.
not give a shit? You do notice. Okay.
Oh, absolutely.
Yep.
I don't say anything, but I'm like, good God, get your life together.
I'm judging. And I'll have friends, even my daughter's husband sometimes will shoot me a text and be like, and don't judge me on my text. I'm like, oh, I'm not. Yeah, I am.
Yeah.
Like,
I think even I text you that of like, I know this is wrong, but
it's just something. It's just, I'm pedantic. It is what it is. Number 8, UFOs, or is that just something made up by rural white trash folk who get drunk on cheap beer?
oh, they're real.
Yeah, white trash. I love it. All right, number 9. It was a cheap shot. I had to take it. It was right there. You set it up. I had to knock it down. Number 9, you're almost 40. Has your doctor started finger banging you yet?
No, next year.
Oh, well, you got something to look forward to then.
Yep.
Bringing flowers, they always like that. Actually, they don't. Didn't think it was very funny at all, but the receptionist thought it was hilarious. Number 10, if you had to live one season in perpetuity, which season would it be?
Oh, wow. Because now that I'm in Texas, it's no longer summer. Spring. Back home,
Oh.
San Diego, summer all day long.
If you were a baseball fan, you just said baseball season. I'm so disappointed.
Nope, not a baseball fan.
Not a baseball fan. Okay.
No, I'll watch playoffs, but not my jam. I'll watch playoffs. That's about it.
Yep. Baseball's like golf. You either love it and you find it fascinating and strategic. And
And then also remember though, I'm a diehard Padres fan. So like, why would I be into baseball?
Yeah, but it's really easy to get into the stadium for parking, concessions, the bathrooms. 500 ball. You get really good seats when you're a Marlins fan or a Rockies fan. So it's always worked. All right, I'll take us into the questions from the comment section. I think you have that.
No, not for today, just because I thought we've already gone so long. But we do have a bunch of good ones in the future, so we are going to cover the next time we get together because we've got great questions and topics. One of them I need to do a deep dive into research. A couple others we will do that are quick hitters. So not today, and sorry for people wanting to be in the drawing, but we finally found a topic we knew we were going to disagree on, and I wanted to do that. But yeah, I think the next 2 episodes are going to be just straight based off of listener questions.
Sounds good. I'm going to take us out then, Dr. Marv. If you enjoyed the show, be sure to like, subscribe, share, and ring the bell. It should sound a little something like this. And if you didn't like the show, just pretend you did and like, subscribe, share, and ring the bell anyway. We want to hear your questions and your feedback about the show in the comment section. We get good questions, we'll answer them during the show. New show drops every Tuesday, so that means roughly 4 shows per month. If your question is chosen to be answered on the show, you'll go into a separate drawing all by itself. And we'll randomly choose one winner at the end of each month who will receive a 3-pound bag of Team Skip protein from TrueNutrition.com. If you have a topic or specific exercise you'd like us to discuss as a main topic on the show, please let us know. Be sure to use the TrueNutrition.com link in the closing credits to save 10% on not just Team Skip protein, but every supplement they sell. Not only do I use Team Skip protein with my clients, but other top prep guys have their clients use my protein because it's that good. Dr. Marv, how can people reach out to you with questions or if they want to hire you?
Instagram, I'm most active at dr.marvin.saysdc. My website for my online stuff is theeducatedmeathead.com. My chiro office is in the Houston Bay area. That's Coastal Performance Chiropractic.
Very cool. If you have too much skin, go to teamskip.com. You'll find all my contact information, including Team Skip merch. Notice that I am also color coordinated with the mic today. I have 9 different colors, so be looking for that in the
Snazzy.
future. How bad is that? That OCD?
It's
Yeah.
pretty awesome.
Of course, you can follow me on IG at Intense Muscle as well. It's important. Keep in mind that this is a team of 3, not 2. Chris is the man behind the scenes who's killing it with the visuals and graphics, and he also plays a massive role in the creative process. This project would not work without him. So from all of us, all 3 of us, we thank you for the support and for tuning into the show this week. Join us again next week for another episode of Between Two Dumbbells.
Dumbbells.